Hello, we'll get started in a few minutes. We're going to give people a chance to come on in. While people are popping into the webinar, there is a handout for this. It's just all the links that are in the presentation, so people can download that, have it for reference, can even open things up as we go through the presentation. But I thought that would be an easier way for people to access some of the links that I incorporate into these slides. So that's under the handouts section of the grid. And as I go through the presentation, feel free to ask questions in the chat box. I'm not always going to see them right when you ask, but I will check periodically to see if there are questions, and I will try to answer as we go through the webinar. So you don't have to wait till the end, but at the very end, we will do question and answer with whatever time we have left. So take a couple seconds to familiarize yourself with the program. Alrighty, people coming in have slowed down, so I'm going to go ahead and get started. I'm going to introduce myself, and then I will be not sharing video of me anymore, so that the presentation can be all that you see on your screen along with the control bar. My name is Shonnessy Gilmore. I'm a certified industrial hygienist with EHS-International. A certified industrial hygienist is someone who does the science and art of workplace health and safety. My specific background is very strong in microbiology, chemical exposures, indoor air quality. So I've been very focused on the COVID-19 pandemic, offering sampling as well as education. But I also offer Legionella consulting. I do a lot of mold and moisture in this rainy Pacific Northwest. So I'm excited to give this presentation. So with that, welcome to this soundbite webinar, and I'm going to minimize my video and we'll get started. So about a year ago now, a little bit over a year ago, in March 2020, we faced the shutdowns for COVID-19. And at the time, the assumption was this is going to be 3 to 6 weeks. You know, everything will be back to normal. We'll be back in our offices. And obviously, there's been huge change because of that. And the immediate focus was preventing the spread of COVID-19. And we didn't really think about what would happen to a building if, you know, only essential personnel were going there, or if it was completely shut down. And these prolonged shutdowns, they really can impact the indoor air quality. They can give opportunities for mold and moisture intrusion. And the water systems. Buildings aren't meant to sit empty, and they're not even meant to just have a highly reduced number of occupants. So this webinar is going to take you through the CDC guidance for reopening dormant buildings. So I have the link in the slides. It's also the first link on your handout. The handout goes through the links in order as I bring them up. You're welcome just to follow along and use those at your leisure. It's a fantastic resource. It gives you the basics regarding Legionella, mold, and copper and lead in pipes. And if you need more help on that, reaching out to an industrial hygienist, an environmental professional can help you get your building reopened. But this is a great guidance to get you started thinking about what you need to do and the timeline for what you need to do. So reopening hazards, obviously COVID-19, we are still in an active pandemic. We are still having about 1,000 deaths per day nationally. We're making great progress with vaccination, but it's going to be months, if not longer, before we return to more of a normal feel with that. So I've given a lot of talks on COVID-19 and safe returns to the office. So I'm not going to focus on that, but I will show you how to get to some more resources on that. Mold and moisture is a big part of living in the Pacific Northwest. You know, we had snow. I definitely know of a lot of people who had unexpected leaks or things that were maintained while their buildings were occupied and had, you know, lower humidity, more use of the system that have gone a little out of control. Legionella is a bacteria that's found naturally in the environment, and it forms these biofilms, which we'll talk about what that is, in pipes and water systems. And one thing that COVID-19 did not slow down was construction. So Legionella, like I said, naturally found in the environment, and it's in the water systems, and it forms these biofilms. Well, when you have construction, when you have things impacting the water pressure in pipes or potentially causing leaks, the disinfectant in water systems might get all eaten up, responding to leaks or cracks in the system, and there might not be enough to disinfect Legionella, or it can be introduced through some of these cracks and leaks, or you can have a significant pressure drop from local construction that causes those biofilms to break free. And we'll talk a little bit about how Legionella spread upcoming, but basically the biofilm full of this Legionella, which is a respiratory bacteria, travels through the building water system, and it can become aerosolized through hot water, showers, sinks, things like that. And then a person can breathe it in, and they're sick with a disease that actually has very similar symptoms to COVID-19. And then copper and lead naturally can build up in stagnant water pipes. So that's an important part of any management system, especially when we're talking about reopening schools. So health impacts. Mold, you know, it causes allergies. It can cause very severe health impacts to people who have a compromised immune system, or people who have existing respiratory diseases or asthma. Legionella causes Legionnaire's disease, which is an upper respiratory illness with a 10% mortality rate. It has more severe health impacts on the elderly or immunocompromised, which again makes it very similar to COVID-19. And we'll have to see as buildings are reopened if there are more cases of Legionella exposure. The hard thing with the current pandemic is if you go into a medical center with respiratory pneumonia-like symptoms, they're going to test for COVID-19 long before they test for Legionella. So we have seen a little bit of a rise in Legionnaire's disease presence with this pandemic, just because it kind of creates a perfect storm of ability for that Legionella bacteria to travel through the system and then infect people. And then lead and copper, it causes cognitive and developmental defects, and it's especially severe in children. There's no safe amount of lead for children. Copper over time can cause organ, like your whole body system toxicity. In general, if you're exposed to high amounts of copper, you're going to have really acute, that means quite severe short-term gastrointestinal effects, vomiting, extreme discomfort, stomach cramps, things like that. So copper, you would have a little bit more immediate notice if you're being exposed at an unsafe level. Lead is much harder to tell over short-term exposure. So Legionella biofilms. A biofilm is basically a sticky patch of bacteria. You know, if you have plaque on your teeth, that is dental caries, dental bacteria in a biofilm. So Legionella basically forms a slime goo biofilm in pipes. And there also be free-floating bacteria, and these biofilms have a large amount of Legionella, but even one free-floating viable Legionella bacterium can cause illness in the right person. And the way it spreads, again, is through aerosolized hot water. So showers are one of the most common routes of transmission, but you also have cooling towers, spas and hot tubs. That's actually why if you ever see a hot tub that's online at a like a hardware store, a home goods store, and they have a hot tub and it has actual water and jets running, they're heavily chlorinated, and they used to not do that, and they actually had some outbreaks of Legionnaire's disease associated with like your Home Depot hot tub section. So that is why if you ever see a hot tub running for a long term on a display, it's going to have the exact same maintenance as a hot tub that's actually in use. Some decorative fountains, mister machines in warmer climates, and water parks again. So basically anywhere where you have pipes running and you have the potential for Legionella, and that's why some of the precautions we're going to talk about are so important. And I'm just pausing to check the chat and the questions panel to see if anyone's asked anything. And we are good. So what is a prolonged period when we're talking a building shutdown? Well, with mold, it can be days, especially in our Northwest environment where we have a very high amount of humidity. We do have a lot of moisture coming from the sky all the time. But it just depends also on the age of the building, the upkeep of the building. So it can be days, weeks, months, or never, depending on a lot of specifics on the age of the building, the humidity you keep the building at, and what the weather of the area is. Legionella usually takes weeks or months, depending on the amount of water usage, what sort of disinfection system the building already has, and has the building already been colonized with Legionella? That means, do you know, are you already testing this building for Legionella? Have you had confirmed cases of Legionella in the past? Copper and lead, again, hours, days, weeks, or months, and it depends on the plumbing, the age of the building, number of systems. So some steps that hopefully your building has been following during this prolonged shutdown is to prevent and just do general upkeep on these. For mold, keeping the humidity below 50% and then having someone who is periodically checking a shutdown building for leaks or odors. Legionella, developing a water management program, which is something typically associated with healthcare facilities. It's a prevention plan for Legionella. We're going to talk more about how you create that program. I think we're going to see a lot more of those coming into play because I think the risk for Legionella has dramatically increased with this level of shutdown around the world. So in addition to developing that water management program, familiarizing yourself with your systems, manufacturer's guidance for maintenance. Legionella can build up in ice machines, things like that. So we'll talk about the basic things you should do to screen for Legionella, but knowing what your system is, what your risk is really important for that bacteria. And then copper and lead, minimizing stagnation during the shutdown. If you have people going into a dormant building during the shutdown, have them run the water while they're there. Copper and lead, and we'll talk about the timeline for all of this, but it is really hard to just go in and say, well, it's Friday, we're going to reopen the building on Monday. So one of the best ways you can do is familiarize yourself with your water. What is the water? And then the first EPA link we have on here, and it's also in your handout, is following the EPA's guidelines for maintaining or restoring water quality in buildings with low or no use. So a lot of this presentation is going to be general information with giving you a lot more resources to follow up on. Just unfortunately, we don't have the time to go into depth on all of these topics, but definitely reach out to me. My contact information's on the handout and at the end of this presentation. So what is a timeline that's reasonable to reopen a building? So in general, when we're talking lead, Legionella, and mold, you really want to start these procedures about 3 weeks prior to when you want to bring people back. I know that's not always viable, but we're going to talk about what the different things you might encounter are and then those timelines. So if you can make the plan now, because like I said, water systems can take a while to get back to the position you want them to be in. If you do have a mold intrusion problem, you're going to want to remediate that. And that can take a while depending on, do you have access to your own facilities crew that can do the construction? Do you have to hire a contractor? Things to consider in that timeline is how old is the building? How old are the systems? Like I said, a brand new building that has kept low humidity through the shutdown, probably not going to have mold issues. The really cool historical building that already had a bunch of leaks, that might be a bit harder to bring back to ready. How often did you have a maintenance crew going in? Did you have a skeleton crew? Did you have a partial number of essential occupants running the system? And then what is the building history? Have you had known Legionella, known mold, anything like that? So planning ahead based on knowledge of the building is really important. And then finally, the occupants. How old are the people coming back? Legionella 55 and over, it really targets in how deadly the response is. Or, do you have immune compromised people coming back and you have a mold intrusion issue? Or, are you reopening a school and you have children coming back and you potentially have lead in the water? So you need to figure out all of those things when you start planning your timeline for reopening a dormant building. Like I said, I'm not going to go into a huge amount of detail on COVID-19, but as a reminder, you must have a written safety program to bring your people back to in-person work. So that on the bare bones, it outlines who the supervisors are, what training you're going to do, and what sort of ongoing training you're going to do for your people on COVID-19. What are your sanitation and hygiene protocols? How will you maintain social distancing? What masking is required? And what to do if you do have an employee who gets sick with COVID-19. So that's the bare bones. Something to consider if you're bringing people back to in-person work is upgrading or increasing your ventilation systems. That can be as simple as increasing the amount of outdoor air in your HVAC system, opening windows as the weather gets nicer, installing MERV, which is minimum efficiency rating value, 13 filters. You might be familiar with those during the wildfires. We always want the MERV 13 filters so we can make our box fan emergency filters to help with the wildfire smoke. So that level of filter helps filter out any active COVID-19, SARS-CoV-2, that's the name of the virus that causes the disease, from your air system. And then you want to work to address your employees' health and safety concerns. I mean, it's very stressful to return to the office during a pandemic after a year away. So just consider your employees' mental health, consider the best way to protect them. Washington State Laborers and Industries has a page that covers everything related to COVID-19, picking the right mask, trainings, business kits, and it links to the governor's page that has links that give specific guidances and templates you can use to make that written safety program. And then my company, EHSI, we have coronavirus resources, including webinar recordings of webinars that I've done, and I'm doing 4 more webinars in that series upcoming that go into greater depth on ventilation, barriers, engineering, masking, updates on the virus and variants, problem solving. So that's a great resource to check out if you want more information for your people on reopening based around COVID-19. All right, so we're going to go through in order and talk about the reopening steps you want to do for each thing, starting with mold. So you want to inspect the building prior to opening by trained industrial hygienists or environmental professionals, or your facilities team if they have that level of experience in mold assessments. And a lot of times you can do a visual and olfactory response. So you just go in, use your eyes and nose, maybe moisture meters, things like that. You don't have to do a lot of expensive testing. Basically see if it passed the sniff test and the visual assessment. If mold is found during this assessment, you need to figure out what is the moisture intrusion, where is the leak first, and fix that, and then, like I said, remediate the mold. So on porous materials, that's usually going to mean you rip them out and replace them. On non-porous materials, you can usually clean them with a detergent solution, let them dry, and go from there. After any necessary remediation, or if you don't have anything that looks suspicious or smells suspicious, you would do a flush out of the HVAC system for 2 to 3 days with as much outdoor air that's possible for your system while maintaining the building temperature. After this 2 to 3 day flush, which again comes after any necessary remediation, you would go back in and see if there's any odor or anything that may have been missed from the original remediation. And then if you did notice anything like that, you would reassess and again, look for mold and moisture, and then perform one more flush out after that level of remediation. And then once you're back in the building, do a weekly assessment and ongoing maintenance to your HVAC systems to prevent mold from opening up. Legionella, so developing a water program management. I'm going to actually take you to some of these links because they're very important. I'm not going to be able to go into the full depth, but the Water Program Management Toolkit is a 40-page toolkit designed by the CDC that allows you to assess your building's risk. You know, what population do you serve? What is your building's history? Do you have a legal requirement to have a water management program, such as a hospital or clinic? And then how to develop a good program. So I'm going to try to switch the screen share to that. And it will. So you would go to this link, the link provided takes you to this page, Toolkit, Developing a Water Management Program to Reduce Legionella Growth and Spread in Buildings. And then you would go to download the toolkit, which I have already done. And it's a 36-page manual. And as I said, it's very user-friendly. It goes into how to use it, like I said, how to tell if your building's at increased risk. So right away, healthcare facilities are their own qualification. And then it talks about, you know, does your building have a cooling tower? Does your building have a hot tub? Do you have a decorative fountain? So this is a really important tool to familiarize yourself with. All right, now I'm going to go back to the presentation. And hopefully that worked. All right, so hopefully now you are back to seeing the presentation. Another link, and there's a lot more links in that original CDC reopening dormant buildings. That's the first link on your handout. But preventing Legionnaire's disease, there's a free training, the Prevent LD training. So that link's also included in your handout. And this helps you, again, create a water management program. So the bare bones essential part of a water management program, you want to create a team. Who in your company, in your building, is in charge of creating the plan, managing the program, and then reassessing it at least once a year or after any sort of event where someone were to contract Legionella. You would map your water system, and this is a smaller diagram for you guys to see. The full page is in the water management toolkit created by the CDC. So what it means by mapping, it's almost like a circuit board. So it's not a literal map of all your pipes. That can be a little confusing for the layperson, but it's figuring out where's the water coming in, and then it goes into the cold water distribution. So in this example building, there's a cooling tower on the roof. There's a decorative fountain in the lobby. There's ice machines. There you have sinks and showers, hot tub, pool. So they have a lot of high risk elements in one building. Then where are the water heaters? And we'll talk about why water heaters are very important in controlling Legionella spread on the next slide, and where hot water storage is. And then where is the hot water being distributed? Because there's a greater risk. Legionella can survive in quite warm temperatures. And like I said, you get infected with it by inhaling these aerosolized particles, which come in, you know, when you're talking showering, hot tub, things that put a mist into the air. And then where's your waste system? Identify the risk. That's the history of your building. That's the occupants. That's how long it's been shut down. Have you ever had a Legionella outbreak before? Then the steps to mitigate the risk we'll go into on the next couple slides. But that might be increasing the water heat for your hot water system and increasing the chlorination for your cold water system. How are you going to monitor? Do you need to do actual water testing for Legionella, depending on your circumstance and the history of the building? And then how are you going to respond if there is an outbreak? And then, as I said, you need to review it. You need to make sure everything's kept documented and kept current. So Legionella, this is a little technical. Again, feel free to type in questions or type into the chat. But we're just gonna go into this. So these are abbreviated steps that are available on the CDC reopening guidance. And they have a lot of links within there that can help you as well. I picked what I thought were the most important things for today's webinar. So ensure water heaters kept maintained and set to at least 140 degrees Fahrenheit. These higher temperatures reduce the spread of Legionella, but they can also pose scalding risks. So you might need to have controls to bring the temperature down to a safe heat before it hits the point of use system. Figure out if your manufacturer wants you to drain your water heater entirely after a prolonged shutdown. The general rule of thumb for Legionella is that anything where Legionella could have a impact, you need to follow the manufacturer's instructions to the T. Flushing your water system, just similar to the HVAC flush, you flush the hot and cold water through all points of use. You might need to do this in segments. You might need to do it just based on the facility size, the water pressure. The flush can be a lot more technical than the one I'm running you through. This is a flush where you don't have a pre-existing risk of Legionella. You haven't had a history in your building. If you've had a history in your building, there's precautions you're going to need to take during these flushes because you don't want the people doing the flush to get exposed to potential Legionella bacteria. So, like I said, there's more instructions. This is breaking it down into the basic things for you to think about as you start planning for your reopening. So flush until the hot water reaches its maximum temperature, and then at the tap, you want it to be at or above 120 degrees Fahrenheit. So remember, 140 at the heater itself, 120 at the tap. But, if this is a school or something where you do need to really control what temperature the water's coming out, because you also don't want to have any sort of a scald or burn risk, that maximum temperature might be limited at the point of use. So maybe you need to use a different system in addition to just heating the water to help take care of the bacteria. Again, you don't want a lot of splashing or aerosol generation during this flushing because you don't want to increase the risk to the people doing this maintenance work. If you have a special water using device like an ice machine, there might be extra cleaning steps because you can get those Legionella biofilms actually in the ice machine system. As a general note, as a former microbiologist, ice machines can get a lot of really unique flora and fauna in them from the bacterial standpoint. I don't personally use them. But again, with any of these water using devices, you want to follow the manufacturer's instructions for any sort of a prolonged shutdown. Cooling towers are a long topic, and I just don't have the time to go hugely into depth on it in this slide, but I include some of the most important links, and again, there's a lot more references on the CDC guidance. And again, if there's anything where you know you have an issue with your building, please reach out. My contact information is on the links page and at the end of this. So ensure the cooling towers are cleaned and maintained, including startup and shutdown procedures, again, per the manufacturer's guidelines and industry best practices. And then I have a link to the guidances for the start down and shutdown that are industry best practices. And then you want to make sure they're clean, no visible slime, no debris, no biofilms. You want them to be very clean and well maintained. If it already looks that way, you would do a disinfection procedure, and then again, a link for the disinfection procedure that is the industry best practice. Then going into those unique systems, the safety things like a fire sprinkler, eye wash stations, and safety showers, you know, if you're a laboratory or a medical facility, make sure they're cleaned and well maintained, follow the manufacturer's instructions and guidances. There's a lot more notes on hot tubs, spas, decorative fountains, and other potential Legionella sources. For limited time, I wanted to cover the things that are most likely to impact the most buildings for this presentation. Maintaining your water system. What does that mean? Consider contacting your water utility to learn about any recent disruptions. Construction system damage, like I said, you might have never had a Legionella issue before, but a construction in the area might have dropped the pressure in the outside system pipes and allowed those biofilms to break through. So you always want to be prepared for that and knowledgeable on that. And make sure that standard checkpoints near the building, so that's where the water's coming in from outside, have been checked, and that the disinfectant residual, so that's the amount of disinfectant that's left over after it's been used to kill any bacteria or virus that's coming in, is the correct amount. Like I said, if you do get some sort of an impact or disruption in the system, the normal amount of disinfectant you're using might get all eaten up with all this additional bacteria and debris that's entering your system and not have enough to meet the standards to control Legionella. And then follow your water management plan and make sure that you're minimizing your risk of Legionella by checking the basic water quality parameters like your temperature, pH, and the disinfectant levels. We're going to go on from Legionella. If anybody has any questions, please type in the chat or use the questions panel. All righty, copper and lead. So copper and lead, one of the most important things you can do is learn about what the water coming into your building does. So looking at your annual drinking water quality report, if you have a private wells, which most of us aren't going to have serving a large building, but check with your area health department on the water quality. Testing your water for lead. A lot of the local utilities already do that testing, so you can just look at their records, or you can request special testing. And then you really want to sample from the faucets that are used for drinking water, cooking. So that's drinking fountains, that's your break room or kitchen sinks. If you have a coffee or hot water system that's ingrained into your, that's incorporated into your system, you want to test that at the filler outlets. There's no point in sampling from faucets that you're not actually using for drinking or cooking. So one of the best things you can do is only use cold water for drinking and cooking. You can heat it up for cooking, but water that's warmer or hot has higher levels of lead. It can get more saturated with lead due to the temperature. Boiling water does nothing to remove lead from water. It's not effective in this. Cleaning your aerators, regularly cleaning your faucet aerators can help with sediment debris and larger lead particles. If you do have lead particles in your aerator and you don't remove them, you basically are adding a small amount of lead to your water every time you use it. Make sure you're using any filters properly. There's filters that improve the taste of your water. You know, they have a carbon base, but they don't remove the lead. You need to make sure the filters, if you're using special lead filters, are certified to remove lead. The picture is just a basic aerator, but it is a lead-free system. So follow the instructions on those for both the installation and how often you need to replace them. Try and replace them before they expire so you're keeping the same level of effectiveness throughout it. And then again, don't use hot water on these filters. And there's a lot more information about choosing the right filter for your system on the EPA's website. Other shutdown concerns. Non-tuberculosis mycobacteria. So basically, mycobacteria is a type of environmental bacteria that can also cause respiratory symptoms, but it is not the tuberculosis bacteria. And it can build up in certain pipes. I included a link to that and the information on that. Disinfection byproducts, you could be creating a hazardous system if you're using more disinfectant than you're supposed to be doing. Just a general note on COVID-19, the amount of accidental poisonings and hazardous like vapor calls and fumes from mixing chemicals are still up really high. So when you're planning both for these system flushes and just your general bringing people back to the office COVID-19 practices, try to use the least toxic, most effective cleaner. So for COVID-19 and surfaces, I really like alcohol-based unfragranced cleaners or hydrogen peroxide-based unfragranced cleaners because things like bleach, they have a really high risk of making your staff develop things like asthma or sensitization, which means you develop a reaction over time. So make sure that you're using the least amount necessary to address the hazard at hand and not having impacts on human health. You can have instances of sewer gas entering dormant buildings. You can have odors that are unrelated to mold. You know, if you're firing up a heater for the first time after a long use, you're often going to get a less than pleasant smell on that, depending on the type of heater. At the beginning, you can get dust and age-related smells. Not going into this in depth here, but if you have any of these issues or you know, you go through the basic building reopening steps and there's still indoor air quality issues, contract an industrial hygienist or someone who understands these environmental hazards for any additional concerns. All right, so we went through that pretty quickly. I'm happy to go to the actual reopening guidance webpage or take questions. It's a lot of topic in a very short amount of time. I think I will go to the reopening dormant buildings webpage just so you can kind of see how things are there. So if you click on the very first link in the handout, it will take you to the guidance for reopening buildings. And it goes through mold. And as you can see, there's just a huge amount of resources. They have resources specifically for schools, and a lot of different plans and templates that can help you out. And as I said, if there's anything that ends up being more than what your facilities team knows how to handle, that's when you do call in an expert. Legionnaires' disease, there's a lot of resources there. So we have the two that I showed you, the water program toolkit and preventing Legionnaires' disease training, but then there's specific guidances for hotels, then the hot tubs and spas, going through the plumbing best practices for vulnerable populations and healthcare facilities, and then preventing occupational, that's your work-based exposure to Legionella, very important. And then lead and copper. There's a lot of really important information there, especially, again, I can't stress it enough, when we're talking reopening schools, addressing this is very, very important for children's health. So a lot of resources, really great introduction to all of these topics. So does anyone have any questions they want to type in? Well, feel free to reach out to me. I'll put it back on my contact page. And we'll be able to, email is always the best way to get in touch with me. And this webinar is being recorded, so that will be available in a few days. All right, with that, thank you, everyone.